slow on the way in. Yeah. Don't want to just flop around. Okay.
Okay, good. So now we can keep pushing and then actually
Everybody
run with
gets a
it.
lollipop
So now
and
we
a
can try
card.
movement with tissue movement as well. Give me a little bit more straight. Good.
$1,000 better than
That is the nicest thing I've ever heard anybody say. Appreciate it every month like that. That's the nicest thing.
It's the truth, right?
It is the truth.
Yeah, done. There we go. And what's the date of surgery?
27th of January.
So pretty good. Good.
What's wrong?
Stand.
What's wrong with dog?
So most important thing is getting knees straight. Quad set. Good. Relax. A lot of times they'll substitute quad with glute. So push down. So this gentleman's doing very well with that. Good. Push down again. Good. And relax. Cool. Good. So set a parameter. So we have the red pad on the quad. We're trying to get initiation of a good contraction. And we have the black pad on the back of the hamstrings because he has like a contraction going on from looking at post surgery.
Complete opposite of my wife.
Wrap it.
At first, I'm like, oh yeah, like with Zoe, I'm like, oh, she's fine or whatever. And Kelly starts freaking out.
And what the machine's going to do, feed's going to come on and off. It's going to sustain a contraction for about 13 seconds, and then it's going to shut down for 6 seconds. So it's going to go on and off for